Hi, I'm Jason Collette, Contract Administrator here at SPEEA. It's open enrollment time for Boeing. I'm going to go through the options and plans that you have for your benefits. The dates this year are November 5th through the 26th. Hopefully this presentation covers any questions that you might have. If there's any afterwards, you can reach me at benefits@speea.org. So we're going to go through a few things here. Dates and details, medical plan changes, dental changes, voluntary benefit plans. We'll cover the FSA. The health assessment is again in effect. There's a slight change to life insurance, and then any questions. So you should see these materials, right? So this year they combined SPEEA and SPIU in the top right, you'll see. So they may not have the premiums in this document because they are different, but this should be the materials that you see from Boeing once the open enrollment session opens. The packets have been mailed out. Open enrollment begins Tuesday the 5th and goes until November 26th. These changes are effective January 1, 2020. They're only in effect for 2020. So, the good news is if you screw it up this year, this is your chance to fix it. If you didn't like your plan, if you wanted something different, now's your opportunity. There is a correction period, right? So make sure your address is correct in Total Access or Work Life Now, right? So you have 20 days to correct that. If there's a mistake, if you chose to make an HSA election and they didn't get it, or FSA, or they have you in the wrong plan. So make sure you open your mail, make sure your address is correct, and then make sure you're promptly correcting those mistakes. All the plans are the same, right? So there's no changes in the deductibles or out-of-pocket maxes for anything except for the Advantage Plus plan, and that's because it's dictated by the IRS. So they changed the deductible slightly, went up a little bit, which means your out-of-pocket max went up a little bit, but they also increased the limits for the health savings account. The health assessment is still in effect, so if you don't take the health assessment, you and your spouse will be penalized $20 per person per month. Dental improvement, right? So the preferred dental plan has gotten a little bit better. The annual limit goes from $2,000 to $2,500. So even more people should be in the preferred plan. Life insurance, they've separated supplemental life. So you as a SPEEA member, maybe you are not allowed to get supplemental life due to evidence of insurability. Your spouse can. So that's a change that will affect very few of you, but it's a good change. So overviews of your 4 medical plans. So there's Advantage Plus. It's a health savings account qualified high deductible plan. This is the free plan. Boeing will give you money if you're eligible for an HSA. Traditional plan, you still pay 5% of the cost of it, 12% for Select and Selections Plus. Selections Plus only in Oregon. Kaiser and other HMOs are 12% as well. You can see the big changes in 2018. Vast majority of people came off of traditional once you started paying for it, and Advantage Plus was incentivized. There's still a good number of folks there. About 90% of you are in Advantage Plus and traditional, which I think is a indication that most of you are paying attention. A quarter of the people in Advantage Plus are also in the UW plan. Only 10% of people in traditional are in the University of Washington Preferred Partnership. There's still a handful of people sticking with Select, and then the people that have Kaiser like Kaiser. So here's the slight changes for the Advantage Plus plan, right? So the deductible went up as mandated by the IRS to $1,400 per person, or family deductible is $2,800. The out-of-pocket max is 2x, so $2,800 for an individual or $5,600 for a family. And if you are going out of network for whatever reason, that's 3 times, so $4,200 and $8,400. Your deductible dictates what your HSA contribution is going to be. So it's 50% of your deductible, so it goes up to $700 for an individual or $1,400 for a family. Coinsurance, 10% in network, 40% after. Difference here is all family members contribute towards the deductible. So if you have 10 people, they all contribute to that $2,800 deductible and the $5,600 out-of-pocket max. Also, your prescriptions are subject to the deductible, which is slightly different from the other plans. Traditional is still 5%. None of this has changed. It's $300 deductible per person, no more than $900 deductible. Out-of-pocket max is $2,000 per person, no more than $4,500. Same 10% coinsurance in network and 40% out of network. You'll see that there's some protections for high costs of prescriptions, right? So you can't pay more than $25 for generic or $75 for a brand name. There is no max for non-formulary. So you can end up paying a lot of money for your prescriptions. Two things to note here: there's a separate out-of-pocket max for your prescriptions, and they do not apply towards the deductible. So no one person can pay more than $4,000 for prescriptions, and the family can't pay more than $8,000. Also, the deductibles are per person again. So those are the two big differences between Advantage Plus and traditional. Select, Kaiser, and Intermountain Healthcare, 12% of the cost of the plans. They all have different costs. The deductible is $0, but you do have an out-of-pocket max that's pretty high, $6,850 or $13,700 for a family. This is still a copay situation instead of a coinsurance like the other plans. So obviously it will take a lot of visits to the doctor or the hospital to get to your out-of-pocket max, but you really pay for this plan with the premiums. Oregon has a different out-of-pocket max. So note that if you're in Oregon. So then the health savings account, this is only available to folks who have the Advantage Plus plan. The concept is pretty simple. You buy a catastrophic plan, and it gives you the option to establish a reserve account, your health savings account. Essentially, you can use that to pay your claims because your deductible is so much higher, or you can invest it. It's a special tax advantaged account, so it's triple tax incentivized. It's tax-free in, it's tax-free out, and it's if you spend it on medical, and it's tax deferred, sort of like your 401k if you end up saving it. This is between you and the IRS, and so if you get crosswise with the rules and aren't eligible to have an HSA or use it improperly, you can be penalized. So make sure that you read up on the rules and educate yourself about if this is something you want to do. Health Equity is the vendor that Boeing uses to administer the HSA. They have a lot of very good resources. I highly encourage you to go to their website to read up on that. They can also answer any questions that you might have about the way it works. There's a fact sheet around how to do the payroll deductions with Boeing. There's Boeing specific stuff as well as federal rules. So again, that website is healthequity.com/Boeing. So highly encourage you all to go there. These are the taxes that you save from being in the HSA. So federal and state income tax, you don't pay Medicare tax, and you don't pay Social Security tax if you have it automatically deducted from your check. The limits went up, as I mentioned earlier, right? So Boeing will contribute $700. Your contribution limit includes Boeing's money. So you can contribute an additional $2,850 for an individual or $5,700 for a family to get you to the annual limit. Again, that changes every year. So be mindful of that when you're making your selections this year from last year. Again, you can use these expenses on any IRS dependent. They don't have to be on your medical plan. Publication 502 covers the eligible expenses. So go there to cover things, but really the rules are simple. Anything that the medical plan covers, the dental plan covers, and then a lot of things they don't: mileage, reading glasses, Band-Aids, things like that. So LASIK, those are some big things that folks use it for. Again, you can use it for non-medical expenses. Encourage you not to do that, since you've never paid tax on it, you'll have to pay income tax, and there's a 20% penalty if you are under 65. Once you're Medicare eligible, you can use this just like you would any other retirement account. But it is a bank account, right? So there are fees, and so you'll want to take a look at the fee schedule. Again, it's on Health Equity's website with Boeing. Some of these are paid for by Boeing, and some are paid for by you. And they're slightly different if you're enrolled in the plan. So read up on that. You'll get 3 debit cards for free. If you need more or you lose one, you have to pay for that. So be mindful of the fees. This is their website. As you can see, there's Boeing specific questions as well as how this plays with Medicare, right? So there are rules. People that can't have a HSA if they have other medical coverage, like a spouse's traditional style plan. If you're on Medicare, Medicaid, if you're a veteran that has a TRICARE, you can't sign up for this plan while receiving TRICARE benefits. So be conscious of those rules and your eligibility. There are other voluntary benefit plans available to folks who are on the self-insured plan. So the not Kaiser, not Intermountain Health, Carena, right? So we've talked about this before. This is urgent care at home, Boeing's a program for folks on the Blue Cross Blue Shield plans. It's a web-based thing. There's a phone call and an email that you can use. They no longer are doing home visits, so that's a change I wanted to call out. But that's still in effect. Centers of Excellence is still in effect. The idea here is to have big things done by some of the best in the country. So providers who are part of the Centers of Excellence program, there's only a handful of them for each thing, right? Whether it's heart surgery or back surgery or bariatric surgery, there's a set number of providers that are contracted out. The plan will pay the cost of those plans at 100%. So there's no coinsurance or deductibles or anything. If you're on Advantage Plus, you will have to satisfy your deductible before the plan covers your benefit, but it is at a 100% rate. They'll cover you and a spouse to fly out to the location, put you up in a hotel, and cover the cost of the care. And the new for this year is Mental Health Care Connect. This is anyone who is receiving care from a University of Washington provider or UW partner. You do not need to be enrolled in the University of Washington plan, just so long as you have a provider in those networks. If you are seeking mental health care, you can call the number through the Mental Health Care Connect program, and they will connect you with a psychiatrist, ideally within 24 hours. It's essentially a navigator program, and so they will funnel you to the provider that's most appropriate for your service that you need, and that is no cost. So this is the Urgent Care at Home website. Again, they deleted the home visits. I don't think many folks were using that anyway, but just in case you were planning on it, it's no longer in effect. So as you can see, it's $40 per visit for the phone call and webcam on Advantage Plus, and then both are free after you satisfy your deductible. Phone calls are always free for traditional and select, and it's a $10 copay for webcams. Hopefully you all are familiar with this website, Blue Cross Blue Shield of Illinois /Boeing. This is where you can get a lot of great resources for your plans, the summaries. It will also show the Centers of Excellence program is here. So this is the website. Go to coverage and plans. We're looking for medical benefits. You can also get mental health. They don't have 2020 up yet, but again, there's the only one that's even a little bit different is the Advantage Plus plan. So 2019. And then you notice in the top right, this is effective 1/1 to 12/31 of 19. Right, so the deductible went from $1,350 to $1,400 this year, but this is the plan from last year. And so you can get a lot of great information about how the plan works. There's a few examples at the end. You know, somebody's diabetic, somebody breaks a leg, or if you're planning on having a child. So you can kind of see how the plan would pay out in different scenarios. So I encourage you guys to take a look at that. These are the premiums for 2019 for the different plans. The Advantage Plus plan I mentioned earlier is free, so that's why it's red, and the money that they give you in your HSA comes in a lump sum in January, but this would be what it looks like if it was prorated to kind of make an apples to apples comparison here. So traditional plan, the premiums this year went up 65 cents, so $31.78 for a single person. Second column is an employee and their spouse. Third column is an employee and all of their children. The last column is employee, spouse, and all of their children. So, you know, times 1, times 2, or times 3. So $30, $60, or $95 for traditional. Select network is very expensive, as I mentioned earlier. It's $80, $160, or $240. It also pays no out-of-network benefits, just like Kaiser, so it operates similar to that. Kaiser Washington is $86 for an individual, $170, $260 for a family. And then you can see the California, $70 and $77 for the Oregon plan. Intermountain Health in Utah is $76. So all of those HMOs there are listed out. So again, fairly significant differences between them and traditional and Advantage Plus. annualized, right? So you get 700 as an individual or 1,400 if you were a family plan in the Advantage Plus. So there's only two groups there, as the other plans are separated into three. Traditional is 380, 760, or 1,200. Select Networks 1,000, 2,000, 3,000. Kaiser is about 1,000, 2,000, 3,000 here in Washington, and a little less in California and Oregon. Intermountain Health is about the same as well. If you are in the Puget Sound and choose one of the self-funded plans, so not Kaiser, you have option for the preferred partnership. It also operates in California as a memorial care, but the limited area for where our folks are is likely not a good choice. If you choose the preferred partnership, you're giving up some network, right? So the Blue Cross Blue Shield is the standard option. It's a global network that we've had for a long time. University of Washington Accountable Care Network is the preferred partnership option. This is where you want to go if you're considering this option. It's SPEEAhealthpartnership.com. So that website should be live again. It was down for update, but I think it is current. And so you can go show that you're an eligible employee, click your location. So in this example, we have Puget Sound. You can scroll through, read up on the partnerships and the benefits that you should be getting. The key here is finding whether your providers or where you want to go, if you don't have providers already, are in network. So hospital and clinic locations or my providers. You can call up a map. And so as you can see, there's great coverage in Olympia, Tacoma, and Seattle, and it gets a lot more sparse as you get further north. So again, limited coverage in Everett. If you're Linwood or south, there is very good coverage for the network. So if you make this choice, you get some things. It's $30 less for traditional and select. So that's 30, 60, or 90 for the plan that you're in, or you get an extra 30% in your HSA. So your HSA contribution goes from $700 to $1,120 or $2,240 for a family. Also, generic drugs are free, primary care is free. If you're on the Advantage Plus plan, those free goodies kick in after you satisfy your deductible. Urgent care, right? So if you're traveling and something comes up and you need to see a doctor, you can always go to the BCBS PPO Urgent Care Network. So for instance, Providence is in network for their urgent care facilities, even if you choose the University of Washington preferred partnership where they're not in as general primary care services. So obviously, if you're traveling around, you're probably not doing routine care on vacation, but if something comes up, you can still have care. This isn't for everyone, right? So if you work and live in Everett, maybe not for you. If you have children or other family members that are on your medical plan that do not live in the western half of Puget Sound, probably not for them. But if you're willing to move your doctors to the University of Washington network or are already there, this is a good plan for you to consider. And here's how it looks annualized over the year, right? So traditional goes from 380 to 20, 40, or 60 for a family. Select network gets a little bit cheaper, but still very pricey. And there's no benefit for Kaiser because it's not part of the plan. Again, you get an extra 30% in your HSA if you sign up for it with Advantage Plus. There are no changes to the dental plans except for, right, so the same choices. You get preferred network, scheduled, or prepaid. You can read up on them at the website deltadentalwa.com/Boeing. The vast majority of you all are in preferred. It's easy to remember. It's the preferred name. It's the preferred plan. A good number of folks dropped off of scheduled in the last year, and we still have some folks in prepaid. Again, this is recommended for the vast majority of you all as the best plan. It has the highest benefit. If there's, it's a PPO, so you need to go to a dentist that's in network to get the highest benefit. 98% of dentists in the state are in. The network doesn't allow folks to go through a balanced billing, so that's a benefit. So find your dentist at deltadentalwa.com/Boeing. And the good thing this year is that the plan increased the benefit limit each year from $2,000 to $2,500 for non-orthodontia. So it's a richer plan than it has been. So even more folks should be signing up for this plan. The scheduled plan hasn't changed in a long time. And so this is a relic of a different time, and hopefully people continue to migrate out of it. So there's a $25 deductible, max benefit is $2,000. There's a schedule of the reimbursement rates in your contract, and it hasn't changed in 20 years. So it's got no network, but so you can go to any dentist, but there's you're going to end up paying a good amount of difference. Here's what it looks like in your contract, so you can read up on it and see how that compares to what your dentist is actually charging you. The prepaid plan, we receive the most complaints about this plan. The idea is that you preemptively select the dentist. That dentist gets monthly payments whether or not you seek service. And then once you do, they don't get any more money because they're still getting paid. So they might not have the best incentive to see you. So again, those are the 3 dental plans. Highly encourage you all to choose preferred. FSAs this year, right? So it's still an option to have a flexible spending account, the same idea as the health savings account, which is to avoid taxes on money that you spend on your medical insurance, right? So it's the same taxes. The difference here is that it's not a bank account. So you can't actually invest this or make money through using this as an account. However, you do get the money up front. So if you say you want $1,000, you can use all 1,000 of it early in the year. Boeing prorates your deductions out of your check by 26. So each paycheck that you get, they'll just take a little bit out to get your amount, but you have it up front. The difference here also is it's use it or lose it, right? So if you have less than $10 or more than $500 from 2019, you will lose that. So you can roll over up to $500 into your 2020 FSA. You can only roll it over once, right? So if you don't spend your 2019 money in 2020, it will be lost. Obviously, you want to, since it's use it or lose it, you want to think about how much it is to, how much you want to invest. So think about how much you spend on medical. So how much did you pay in copays, your deductibles, coinsurance, et cetera. And then there's a lot of things that are not covered by the medical plan that are eligible as well. So driving to and from, your Band-Aids, your other ointments, things like that you bought over the counter. So you can add those to your FSA expenses. Make sure you comply with the SPEEA, the summary plan description, as well as the IRS has their own rules around the way FSAs work. If you are eligible for a health savings account, you can also have an FSA. This is really for folks that are already maxing out other ways to funnel money away from the IRS and to maximize their health savings account as a retirement vehicle. So I encourage you not to treat it as your FSA, since it is a very special account and you can invest it and keep it over time. So if you're maxing out your HSA and want to put more money into your FSA in order to preserve your health savings account, you can. It's called a limited purpose FSA, and Boeing will automatically sign you up for that. The rules are slightly different. So you can spend it on, it's unrestricted after you satisfy your deductible, but before you satisfy your deductible, you cannot use your FSA, your limited purpose flexible spending account, on anything that's subject to the medical plan. So after you've satisfied your deductible, it operates just the same as a normal FSA. Prior to that, it's a little more restricted. So again, we have health risk assessments in place in 2020. So you'll need to go into the step-by-step program to take your health assessment. It's got a new vendor this year, so it's no longer through WebMD, but it's the same idea as that filling out a questionnaire, helping you be aware of your health and welfare to sort of maximize your outcomes. The good news is this year you can opt out of the phone call from the nurse. There used to be no option to do that, so now you can. Your children do not need to fill this out. You only need to do it for you and a spouse if they are covered on your medical plan. Again, life insurance, there's a very small change this year. Member spouse may purchase supplemental life whether or not the member has supplemental life insurance. There's no change to the amount or rates, but this does have a outsized impact on a few members, and so their supplemental life insurance plans are delinked, and so that is an advantage for folks. This is a page for your resources of where to get information about your plan. Davis Vision is your vision. Express Scripts is your pharmaceuticals. So that's the open enrollment materials for 2020. If you have any questions that I didn't answer, you can reach me at benefits@spea.org.